how prevalent is BPH? BPH, or benign prostatic hyperplasia, which in more simple terms is an enlarged prostate, is exceedingly common. Estimates vary, but up to 60 to 80% of men, once they hit age 65, will have some urinary symptoms related to BPH. How has technology for BPH treatment improved over the years? It has improved drastically. We were at one time limited to just 2 to 3 surgeries to address urinary symptoms related to BPH. Nowadays, there are at least 11 and even more emerging treatment options for BPH to the low teen numbers. So now procedures are offered in the office or surgery center, as well as in the hospital. They are typically minimally invasive with no incisions or cuts, with very good outcomes that are comparable to the gold standard of treatment, which is a transurethral resection of the prostate, which has been done for decades and decades. Which procedures are best for severely enlarged prostates greater than 90 grams? The procedures for those sizes of prostates are often robotic simple prostatectomy, which is actually a transabdominal surgery, a transurethral resection of the prostate, or TURP, which is a long-standing treatment option for BPH. And more recently, Aquablation has emerged as a very good treatment option for these enlarged prostates that is being more and more commonly used for prostates greater than 90 grams. How successful are interventions for treatment of BPH? They are very successful. Outcomes in terms of improvement in urinary symptoms and quality of life are upwards of 80 or 90%. A lot of it can be determined on degree or severity of symptoms prior to surgery, and can also be impacted by procedure options that are chosen. However, whichever procedure option is chosen, outcomes tend to be very favorable for these patients. What is the rate of retreatment after surgery for BPH? Retreatment rates typically are very low. They hover in the 10 to 20% range out to 10 to 15 years after surgery. That can vary based on procedure option that is chosen, but generally speaking, 10 to 20% of patients between 10 and 15 years will need a secondary procedure for recurrent urinary symptoms, often related to regrowth of the benign prostate tissue. The differences between office-based or surgery center-based procedures for BPH and hospital-based procedures for BPH. The main differences are the technologies that are used. There are several treatment options that are available and that can be done in the office or in an ambulatory surgery center. These procedures are well tolerated with mild sedation and local anesthetic with very good outcomes. There are also procedures available that are done in the hospital under general anesthesia. Some of them are outpatient, some require overnight observation afterwards. As far as which treatment option is a good option for you, oftentimes that comes down to how large your prostate is, how big does it measure, and what is the internal shape of the prostate. Those two factors often play a large role in determining candidacy for which procedure we may choose. What are the differences between in-office or ambulatory surgery center-based procedures for BPH and hospital-based procedures for BPH? The differences boil down to what technology is used to address the enlarged prostate. There are several procedures that are available to be done in the office or in an ambulatory surgery center that are well tolerated by patients with some moderate sedation and local anesthetic. These have very favorable outcomes in terms of treatment success. There are also procedures that are offered in the hospital under general anesthesia, some of which are outpatient, some of which require an overnight stay in the hospital. In terms of which procedure is right for you, oftentimes we use a workup to determine the size and internal shape of the prostate to determine candidacy for each of these procedures. And then a discussion is had regarding patient preferences based on their anatomy and success rates. Regardless of which procedure option is chosen, all of the procedure options for enlarged prostate or BPH have very favorable outcomes with good improvement in urinary symptoms and quality of life.